Assalamualaikum and hi to Madam Yatul Izian. Today, we are from Group 1 and we will be presenting about our roleplay video that we did titled Ethical Communication in Hospital Customer Service. To start, my name is Nurul Natasha Amrina binti Muhammad Zulkifli, and today I will be explaining about the role each member in our group has. So to start with, we are a 4-member group. And our first member is Siti Mariam binti Muhammad Rani. And in this role play, she plays as the staff nurse, and she is a character that is actually responsible to manage and also resolve the main conflict in our role play. So she is someone who is calm, firm, and also empathetic when she intervenes in the conflict and offers solution by actively listening to the patient's concern, and she also upholds the patient rights, dignity, and also emotional well-being. And moving on, next, the second member is myself, and again, I am Nurul Natasha Amrina, and I play as the customer service officer who was actually involved in the main conflict with the patient. And my character is someone who can be a bit defensive, and she is dismissive towards the patient concern, and she also has poor communication skills when interacting with the patient. So as a customer service person, she should have the knowledge and also the patience to handle customer. But nevertheless, she has learned her lesson and she now understands the importance of communication, especially for someone in her field. Okay, now we move on to our next slide. So in the next slide, we have our third member, Nada binti Mansur, and she is wearing the light blue color, and she plays as the patient who was actually involved in the main conflict with the customer service officer. And she actually came in the hospital to seek transparency and also honesty because she had unclear information about her hospital charges. But unfortunately, she was treated unkindly by the hospital staff. But luckily, she received the best help and also guidance that she needed. And moving on, last but not least, is our fourth member, who is Nurul Aini binti Nurul Hakim, and her role is Hospital Relations Officer. And she is basically the hospital manager who oversees the entire operation and also administrative matters to ensure that the hospital services are delivered effectively. In this role play, she actually took responsibility to make sure that the patient is well cared for during her hospital visit, and she offered the best solution to the patient. So that is all for our role of each member. Thank you from me. Moving on to our next presenter. Thank you.
Alright, so moving on this slide, we were looking at the main ethical dilemmas in this scenario. First up is lack of ethical communication. Basically, the patient didn't get a clear explanations about the medical charges, which left her confused and frustrated. The next issue is poor active listening. The customer service officer did not really pay attention to the patient's concern and kind of dismissed her questions. Then, we also have defensive and unprofessional behavior. The staff reacted defensively, which made the patient feel blamed and ignored. It is clearly not ideal to behave like that, and as a healthcare provider, we should give the best to the patients who in need it. In this role play, we also see a violation of patient rights. The patient's right to transparency, respect, and clear information about her treatment and billing wasn't respected. Another point is lack of empathy, where the patient's emotional distress wasn't acknowledged, which made the situation even worse. Finally, there is a failure in accountability and transparency. The charges were explained as just being system-based without proper verification or explanation to the patient.
Next suggestion. There are few suggestions from this roleplay. First, strengthen ethical communication training. Hospitals should provide regular training for customer service and frontline staff on ethical communication. This training should focus on empathy, respectful language, appropriate tone of voice, and professional behavior. Ethical communication is a core responsibility in healthcare. For example, staff, instead of saying, "We are busy, please make it quick," staff should say, "I understand your concern. Please allow me a moment to assist you properly." This small change can make patients feel respect and valuable. Second, promote active listening practice. Staff should give patients full attention, avoid interrupt them, and acknowledge their concern verbal. Active listening helps patients feel heard and reduce misunderstanding. For example, staff can saying, "I understand why you are confused about the charts. Let me explain them one by one." This moment show empathy and builds trust between patient and hospital staff. Third, improving transparency in billing communication. Hospitals should ensure that all charge, treatment, and medication are clearly explained to the patient before discharge. Both written or verbal explain should be provided, and patients should be encouraged to ask questions. Transparency helps protect patient rights and build trust between patient and healthcare provider. For example, staff, instead of giving a print bill, staff should explain each charge clearly by saying, "This charge is for your medication during admission, and this is for the treatment provided." Lastly, encourage a patient-centered culture. Healthcare organizations should treat patients with dignity, respect, and fairness. Staff should understand that patients often ask questions because they feel anxious or worried, not because they want to complain. For example, when a patient looks confused, staff can say, "It's okay to ask questions. We are here to help you understand." This approach helps patients feel safe, respect, and valuable.
In conclusion, this roleplay highlights the importance of ethical communication in hospital customer service. Poor communication, lack of empathy, and insufficient transparency can lead to patient dissatisfaction and emotional distress. By practicing active listening, showing empathy, respecting patient rights, and providing clear and honest information, healthcare professionals can resolve conflict effectively and build trust with patients. Ethical communication is therefore essential in assuring quality patient care and maintaining professionalism within healthcare organizations.